Debra Kwasnicki, thank you so much for joining us as part of our Leaders Unleashed series. You've got quite an interesting story in that you started out in the corporate sector for 30 odd years and then left it all behind to embark on quite a personal journey. I'd love it if you could take us through that.
Sure, Jo, thanks. Look, I had been working pretty hard for 30 years, bringing up children, and towards the later years also looking after my elderly father. And, you know, working pretty hard in the corporate world, lots of travel, not great work-life balance, as many of us go through. I took a breath when my youngest finished school, as I think we often do, and started to think about how I could now use that relief from mothering and being the sort of primary carer for my father, to how I could now really give back. You know, I feel very young and healthy, and I've got a great set of experiences in the corporate world, and I wanted to find ways that I could actually contribute a little bit more than just as I had always done. So I was incredibly lucky at the time. I felt that I was privileged that I could give part of myself in terms of time and skills to a cause, and so I started looking for an organisation that I could actually give something back to. I met Kathy Burke through a gorgeous client of mine who referred me to her, and when I learned about the Hunger Project, and particularly the way it's primarily not an aid-giving organisation, but it's about helping people help themselves, it really struck a chord with me. And so Kathy and I went through, I guess, a range of conversations, and I felt incredibly privileged that Kathy and the Hunger Project found a way that I could actually give back. And that involved me going to Malawi and spending 6 months living over there. And it was really important to me that I didn't want to just sort of fly in, you know, do what I could in a sort of, you know, in a whistle-stop tour, but actually live there to really understand the complexity around the people and the journey that they're going on. You know, I think it is really hard from where we sit to really understand why people are in the situation that they're in and how difficult it is for them to get out of it. There's a whole lot of economic factors, political factors, depending on what country you're in. And so that was something that I really wanted to do, was to actually immerse myself in that culture. And it was the richest experience I've ever had. I felt like incredibly privileged to have been able to do it.
Having seen it all firsthand, what sort of impact is the work of the Hunger Project having in Malawi?
Let me give you an example. One of the very first epicentre visits I did, I met a woman called Rose, and she is a woman about my age. She has AIDS, and she has one eye, and she is a widow. I asked her how many children she has, and something that I discovered was more normal is that the question is answered in the way that these are the children that I have left. So she had 3 children left of the 8 that she'd given birth to. And we chatted, and she was telling me, as a result of the work of the Hunger Project, she had been able to not only feed herself and her children, but the excess grain that she'd had from the food program had enabled her to actually pay for her children's schooling. And later the same day, I met her son, Dennis Denga, who, as a result of him being able to complete his schooling, can speak English, and he was then employed by the government health office, and he works in their epicentre medical facility. So I'd met Rose earlier, and now I met Dennis. And Dennis and I could sit down quietly and have a conversation in English because of his education. And completely unprompted, Dennis said to me, the Hunger Project is amazing because my mother can now get access to her AIDS medication within 1 kilometre of her home, where she used to have to walk about 20 kilometres, which meant that she didn't always make the trip, and therefore she didn't always get access to medication. As a result of my education, I've now got a job and I can now support the family. But the thing that really struck a chord with me is he said, you know, before we've had organisations who've come and given us things. And they've come and they've given us things and they've left. But the Hunger Project have come and they partner with us. They work with us. They support us in our journey. They have helped us build the epicentre. And his words were, they have helped us build this epicentre. They've helped us build this medical centre. And now we can support our own community and help them with their health, in giving birth to children safely. And he said they're with us the whole time. And it was really touching because it was completely unsolicited. I would have loved to have filmed it, but I couldn't because I just felt that it would sort of break the spell of what he was telling me. There was nobody else around. He wasn't telling me because he was up on a stage. And it really struck me because that was one of the things that I loved about the Hunger Project. It wasn't about giving. It was actually about helping and supporting and helping people as they go on their journey. And I think that's probably the best example of the impact that the Hunger Project has on communities. And in Malawi alone, there's 8 epicentres. And if you think about, 20,000 people roughly per epicentre, there's an awful lot of people who are a lot better off. Now, there's an awful long way to go.
Obviously, your experience was unique and a rare opportunity that's not available to all of us. What would you say is the one thing we can do to make a difference?
That's a great question, Jo, because one of the last things I did in Malawi before I left, as I was thinking through how can I continue this journey, how can I continue to support this organisation even after I've gone home, I was sitting through the budget session. It was early December and we were coming up to the budget for 2012. And I've been through a lot of budget sessions in many corporates. And the way the country director ran the session was, we're going to start with the ideal budget, what we could do if we had access to pretty well anything, and then we'll work back to what we can do with what we get given from the funds available. And we started off with the lovely to have things like it'd be great if we could replace this 1982 laptop with a 1998 laptop. It would be great if we had curtains on the walls because it regularly gets to over 40 and the finance director is sitting there with the sun belting in on him. But we then got down to some amazing things, just like fuel to get out to the epicentres for the vehicles, for the Hunger Project staff to get out there. And then it got down to, well, this epicentre is starting to, needs another paint, or this epicentre needs some more boreholes because of the growing population. This epicentre has some medical equipment, but not, they could always use more. I mean, this is the very basics. And the sad thing was that when we started with the ideal budget and we got down to the budget that we had on the funds that were available, some of the things that we had to take out of the budget were just heartbreaking.
What sorts of things in that budget needed to be cut?
Well, by the time we got to the end of 2 days, because it took us 2 days to actually go through the cutting exercise, we were cutting out things like boreholes for epicentres. Now, just to give you a sense of what that means, I went to some of these epicentres where there were not many boreholes. In fact, I went to one of our very new epicentres where there are no boreholes. I went down one of the wells that the women have to go down every day to get their water. And in most cases, that's after they've probably walked for about an hour to get there. This is a scary, very deep, very dirty, very smelly well that there's no glamorous, bucket that goes down. The women have to climb down into the well. They have to scoop the water out in their buckets, and then they have to climb back out. I went down there. Flies, insects. It was pretty horrible. And as we were going through the budget session, we got to a point where it was, well, maybe we can't put in that many boreholes this year. We'll have to maybe put in some next year, or 2013. And I must say that broke my heart, because it's a point where you want to say, I'll find the money. I'll find the money, because those women can't walk for another year to get access to fresh water. And that's where it just came home to me in a moment that what I need to do when I go home is just find more money. Just find more money and ensure that Malawi and all the other countries where THP operates has more money, because that's the answer. That's the answer. The impact of me going there and spending 6 months is gone already, I'm sure. But the impact of sending more money over will have such a real difference. And that's what I'm now planning to do with my life.
Debra, this series is about leadership. What did you learn about leadership from the women in the villages in Malawi?
I think what I saw over there was an amazing amount of courage by the most unassuming people in order to take themselves from where they are to where they need to be. It's easy for us to say, well, there's a group of very poor people and the Hunger Project will come and help them to end their own hunger. But what these people really need to do when they're on the ground is to do things that frighten them, to do things that they can't see. They can't see an end to hunger because it's not part of their frame right now. It's hard for them to visualize it. So they need to do things, they need to gather and create leadership roles. And the most amazing women and men will rise up and they will take on leadership roles in their community. Whether it be a youth who is going to take on a role of advocating risky behaviour with his peer group or her peer group and how they should embark on using condoms, and then go ahead and distribute those condoms to their peers, is a courageous act of leadership when you try and relay that to people that we know. And I think what we saw is, what I saw it was leadership comes from the most unassuming people. But those people that can visualise what their actions, the impact their actions can have, and then have the courage to step up. And I guess then coming home, I was in a sense placed into a position of leadership that I didn't, I guess, ask for. A lot of people who just knew that I'd been on this journey started asking me about the impact and what I was going to do. And I've never been one to take on a cause, but I think you just have to step up. You see the need and you just have to step up and start to explain to people why you're doing what you're doing. And the most amazing things happen as a result of that. People follow you. And all I've done is just take a little leaf out of the book of some of the many inspirational people that I met over in Malawi who have nothing, but they have nothing to lose. And they're ending their own hunger and poverty by taking some really courageous actions. And, if they can do it, I can do it.
Thanks very much, Debra, for being a part of this series. It's been so inspirational.
You're welcome.